is what's getting us through this. That's the only thing.
The Sims family of West Georgia has been through quite an ordeal in the last 5 years.
In that time, 3 different family members have become patients at Cancer Treatment Centers of America, and their cancers don't appear to be genetically linked.
But that doesn't make the uncertainty they're facing any easier. The Fox Medical Team's Beth Galvin is here now with their story. Beth?
And Tom and Marissa, the Sims family does have a pretty strong history of cancer, especially if you look at colon cancer. So they always figured if they ever got sick, that would be what they'd be facing. But that's not what happened.
Get out and start doing some yard work.
The Sims of Hogansville, Georgia are tight, woven together by a deep faith that has recently been tested by cancer. 67-year-old Brenda Sims, the matriarch, was diagnosed first in 2014 with early stage breast cancer.
I had lumpectomy and radiation.
It was caught early, which is always key, and she's had an excellent response.
And in a way, the family almost expected this.
My aunt had breast cancer. My grandmother died of colon cancer.
Well, I'm glad you're getting a really good response.
Brenda Sims' oncologist, Dr. Madi Taha at Cancer Treatment Centers of America, says about 5 to 10% of cancers are thought to be passed down through families. But Brenda doesn't carry the gene mutation that could raise her daughter Michelle's risk of breast cancer. Yet in the fall of 2017, Michelle, who was then 44,
One more.
developed back pain and then a nagging cough. And the lung specialist she saw couldn't figure out why.
And then he said, well, let's just do a CT just to be sure. And they called me in to see the results of the CT, and it blew me away.
Because that scan of Michelle's lungs picked up something very wrong with one of her kidneys.
And the doctor gave her the results that she had kidney cancer and it had already metastasized to her lungs. She got that results by herself and called me.
That's when Brenda called Dr. Taha.
I felt terrible. I immediately asked her to bring her in so that she can be evaluated.
And with that, Michelle became a patient here at Cancer Treatment Centers of America, diagnosed with stage 4 renal cell carcinoma or kidney cancer.
Our faith is getting us through this. It's the only thing that can get us through this.
And here's where things get even more complicated. Michelle's son, 20-year-old Trevor, is also a patient at CTCA, being monitored for a benign or non-cancerous mass on his liver. Their 3 cases don't seem to be genetically connected, but Dr. Taha says that doesn't make the uncertainty any easier.
The what ifs, the concerns, the possibilities. What's important to note is that if you do have an abnormal pattern with a strong family history of cancer, that you keep it on your radar and you get evaluated really quickly and be on top of your medical screenings annually.
Brenda's now 5 years out with no sign of cancer, and Michelle is on a targeted therapy.
She's doing well. She's had a response to her treatment. Her scans look absolutely stable.
And Michelle Morris has a message for others.
Don't ignore symptoms. Go get it checked. Don't ignore things. You know your body.
And if you have a first-degree relative, like a sibling or a parent who's been diagnosed with cancer, it's really important to talk to your physician about your own risk, especially if that relative was diagnosed early on when they were younger. The doctor can help you decide when to start getting tested for that particular cancer and how frequently you should come in to be checked. Tom and Marissa, that's really important to kind of find out what your family history is, what's been passed down, what you're seeing in your family in terms of cancer, and then to pay attention to that and use that as an impetus to stay healthy and get screened.
And I think with this family in particular, it's not genetically linked.
Yeah,
so you want to know why.
We don't know why. And a lot of cancer, we just don't know why.
But that family history is so important.
It is.
Great advice. Beth, thanks.